Hi guys, my name is Jillian Cutner. I'm going to be talking to you guys about Jeffrey Dahmer, the Milwaukee cannibal today. As just a quick side story before I get started, Jeffrey Dahmer can almost be attributed to why I am in a master's criminal justice program today. I remember I was about 8 or 9 and I was watching a documentary on A&E with my dad and it was on Jeffrey Dahmer. And that was really my first introduction to the criminal justice system and I was totally intrigued and now I'm here today. So thanks, Jeffrey Dahmer. Jeffrey Dahmer was born on May 21st, 1960, to Lionel and Joyce Dahmer. He was the first of 2 sons. Though he had an apparently normal childhood, Dahmer became increasingly withdrawn from his social surroundings beginning around his early teenage years. Although denied by Jeffrey himself, it is widely believed that Dahmer was sexually molested at age 8. Jeffrey's father, Lionel, was a chemist, and Jeffrey quickly became interested in the sciences. Neighbors would later recall that Dahmer would collect insects and preserve them in jars of formaldehyde. Later in his life, he would conduct sickening science experiments on animals before mutilating and disposing of them. Many forensic mental health professionals agree that animal cruelty is one of the childhood activities that strongly correlates with future sadistic offending. By Dahmer's freshman year at Revere High School in Ohio, Dahmer realized he was homosexual and began to frequently abuse alcohol. Dahmer's alcoholism and repressed sexual tendencies were only further fueled by his parents' divorce when he was 17. Dahmer would later state that it was during his parents' nasty divorce that he first fantasized about murder. Dahmer felt like his life was spiraling out of control, and he began to believe that murdering someone could help him gain control of his life. Psychologists claim that serial killers gain control by controlling others. Just 3 weeks after his high school graduation in 1978, Dahmer picked up 18-year-old hitchhiker Stephen Hicks. Hicks would become first of Dahmer's 17 known murder victims. Dahmer was never caught until he confessed by police for Hicks' murder. Dahmer eventually joined the Army, though he was deemed unsuitable for military service because of his alcoholism and discharged not even 2 years later. Dahmer eventually settled in Milwaukee, Wisconsin in 1985, and he maintained a steady job at a chocolate factory. Dahmer was convicted and put on probation for exposing himself at a state fair in 1986. Though his terms of probation carried that he undergo psychotherapy, this was never completed. After a long dormant period, Dahmer killed his second victim in 1987. Between 1987 and 1991, Dahmer began murdering more and more men at increasingly accelerated rates. His modus operandi for most of the crimes was luring men, who were usually African American, male, and gay, that he met at gay bars or shopping malls, back to his apartment by offering them money to pose nude for him and allowing him to take pictures of them. Once back at his apartment, Dahmer would give his victim a laced drink. He would sodomize, rape, murder, dismember, and sometimes eat his victims. Dahmer is what we would describe as an organized and hedonistic serial killer. In September of 1988, Dahmer lured 13-year-old Annuoke Synsophone to his apartment using his usual modus operandi. Though Dahmer drugged Annuoke, he escaped and quickly implicated Dahmer. Dahmer eventually pled guilty to sexually assaulting and enticing Annuoke. Dahmer was analyzed by 3 psychologists prior to his sentencing in this case. They all concluded that Dahmer was a manipulative alcoholic abuser who may suffer from schizoid personality disorder. Not knowing that at this point Dahmer had already sexually assaulted and killed 5 men, the judge let him off with a 3-year probation sentence, which was suspended after only 10 months. Dahmer was able to successfully murder 11 more men, if not more, over the next few years. Dahmer was never even suspected of anything until police officers were taken to his apartment by a man named Tracy Edwards, who had escaped from Dahmer's apartment in July of 1991. The police officers stumbled into a literal house of horrors. Dahmer's apartment was filled with decaying, dismembered men. Dahmer had even eaten some of the men. Soon after his detainment, Dahmer admitted to killing 17 men. He pled guilty by reason of insanity. Dahmer's fear of abandonment stemming from his parents' divorce fueled his post-mortem behavior with his victims. Dahmer said he enjoyed eating his victims' body parts because it made him feel closer to them. Dahmer would perform a sort of primitive brain surgery on his victims in an effort to create a zombie to keep him company, to be his personal friend that never leaves, and to be obedient towards him. In essence, a sex slave. Though Dahmer may have shown some signs early on in his life that he may one day become a sexual criminal, there was little evidence to suspect that Dahmer would grow up to be a horrific serial killer. Both the prosecution and the defense looked to mental health professionals for assistance with Dahmer, namely, was he sane or was he insane? What resulted was a classic battle of the experts. Dr. Carl Wallstrom, Dr. Fred Berlin, and Dr. Judith Becker were brought into the case to testify on behalf of the defense. Dr. Wallstrom recognized that Dahmer, with his zombie-like companion fantasies, seemed to be psychotic and delusional and may have exhibited signs of having borderline personality disorder. Dr. Berlin recognized that Dahmer was suffering from a severe case of necrophilia, which is a sexual attraction to corpses. Berlin believed that necrophilia was comparable to a cancer of the mind. Dr. Becker furthered this idea by introducing that Dahmer was suffering from cumophilia, a sexual attraction to those in a comatose-like state. Becker believed that Dahmer was insane and urged that he be sent to a mental hospital where he could receive further treatment. The prosecution and the court brought in 4 further mental health experts. Dr. Frederick Fostel and Dr. Park Dietz concluded that Dahmer may have had a mental disease and that he definitely suffered from multiple severe paraphilias, but that neither of those 2 things would have interfered with Dahmer's ability to recognize the wrongfulness of his acts. Dr. George Palermo and Dr. Samuel Friedman concluded that Dahmer was a very sick man, possibly suffering from some sort of personality disorder, but that he was sane. Dr. Palermo believed that Dahmer's mutilation and cannibal treatment of his victims suggests that Dahmer was a sexual sadist. Dahmer was eventually found sane by a jury. He was convicted of 15 murders and sentenced to 15 consecutive life terms. Eventually, a 16th life term was tacked on when Dahmer confessed to the murder of Stephen Hicks back in 1978. In 1994, Dahmer was murdered by a fellow inmate in jail. Jeffrey Dahmer has become one of the most prolific and widely known serial killers to date. Identifying serial killers like Jeffrey Dahmer before they become serial killers is an extremely difficult, if not impossible, task. As in Dahmer's case, serial killers who are sexual sadists are not very forthcoming about their fantasies. If the criminal justice system had followed up on Dahmer after his 1988 sexual assault and enticement of amioxensiphone and mandated that he receive treatment for longer than a 10-month period, nearly a dozen more victims may have been spared from Dahmer. Regardless, because of Dahmer's subsequent cooperation and personality testing after his detainment, psychologists have been able to better understand and identify the risk factors and trait characteristics of serial killers. Analyzing Dahmer's mind allowed the mental health community a deeply needed insight into what motivates many serial killers to behave the way they do.